Hi, everyone. Welcome back to the FemHealth channel. My name is Dr. Sayana Gori. I'm the founder of FemHealth, and today I am chatting with Dr. Kim Thornton, who is a reproductive endocrinologist and infertility specialist with RMA of New York. Welcome, Dr. Thornton. Thanks for being here.
Thank you for having me.
So today, the subject of our conversation is going to be optimizing fertility with PCOS. So if you can just give us like a very brief intro on what PCOS is and how it affects fertility, and then we can get into ways to optimize it.
PCOS stands for polycystic ovarian syndrome. It's one of the most common gynecological disorders of reproductive age women. It's typically characterized by three different things, and that is irregular menstrual cycles. So it's very common for women with PCOS to skip menstrual cycles or maybe go a little bit longer, like a month and a half between cycles. They often have signs of what we call elevated androgens, which means like male hormones like testosterone and DHEAS, which we sometimes see in the blood, or sometimes that can be symptoms like extra acne or hair growth on the face, abdomen, and belly, or sometimes even hair thinning or hair loss on the top of our head. And they often have what we call PCOS-looking ovaries on sonogram, which means that they usually have a lot of follicles, which are these little fluid cavities where an egg grows. Typically, women with PCOS have 12 or more follicles on one of their ovaries.
And what is something that these women can do to optimize their fertility, since getting pregnant with PCOS is harder for them?
Getting pregnant with PCOS is often a little bit more challenging, especially because these women often ovulate irregularly. So it's very hard to know when to time intercourse for pregnancy when your ovulation is irregular. It's also just, less opportunity. Somebody with regular menstrual cycles every, 28, 30 days at best, that's 12 opportunities a year because we're only fertile around the couple dates we ovulate. So if that's getting stretched out for a couple of months out, it makes it more challenging. We do know that things that are helpful with PCOS that can help women regulate their menstrual cycles is eating a healthy diet and having a healthy BMI or body mass index. So ideally between a BMI between 18 and 25 has the best outcomes for PCOS. So if somebody is overweight, losing weight can help. It seems to be a disorder that makes people a little bit more prone to prediabetes and diabetes. So avoiding foods with a lot of processed sugars can also be beneficial.
Do women with PCOS sort of need to start thinking about fertility and egg freezing, would you say earlier in life, or what's your sort of opinion on that?
It's never a bad idea. I mean, it's definitely always good to speak with a fertility specialist, review your goals of when you want to start a family, how many children you want to have. It's more common for women with PCOS to potentially need fertility medication or intervention. It often can take longer to get pregnant. And so, not everybody with PCOS maybe necessarily needs to freeze their eggs, but if you have PCOS, it might be a little bit challenging. You also think you might be starting your family above age 35 when it starts to become more challenging for all women. Those sort of risk factors together might, lead to, that being something that might be really smart or something to be to consider.
So comparatively, with a woman who doesn't have PCOS who's 30 and a woman who does have PCOS, same age, in general, you would say the woman with PCOS is likely to have a harder time. Of course, not everyone will experience that.
Exactly. And of course, it's not impossible to get pregnant naturally with PCOS. Most women do still ovulate regularly at some point. But it often is just more challenging.
So is that the main issue, is the lack of ovulation, or are there other factors that come into play?
The main issue that we know is linked for at least fertility issues with PCOS is the irregular ovulation. There have been studies looking at if it, affects egg quality or implantation, and the data is really conflicting, and it doesn't seem to be that that's a universal link with PCOS, but the big fertility factor is the irregular cycles, irregular ovulation. That being said, PCOS can cause other problems. And like I mentioned before, it can increase the risk of prediabetes and diabetes. Women with PCOS are at higher risk for cardiovascular disease. They are higher risk for obesity. So there can be other health implications outside of the fertility realm.
Is the rate of miscarriage once pregnant or rate of successful sort of live birth different once the patient with PCOS has already gotten pregnant?
So actually, most data don't support that women with PCOS have a higher rate of miscarriage. The one thing we do know is women with diabetes with uncontrolled sugars, have a higher rate of miscarriage. And so since there is an association with higher rates of diabetes with PCOS, if somebody is undiagnosed diabetic and they don't have good sugar control, they would be at a higher risk for miscarriage. But with normal sugar control, we don't really see a strong connection.
Is there any kind of additional screening that's done for PCOS patients when they get pregnant? Like, I mean, of course, everyone does the glucose tolerance test, but do you ever recommend it being done even earlier in pregnancy?
A lot of women with PCOS end up getting an early screen for the glucose tolerance test. So while most pregnant women only have to be screened once, women with PCOS are often screened early on in the pregnancy and then repeated again at the standard time when most women are tested, because they also have a higher risk of gestational diabetes, which is when you temporarily have diabetes just during pregnancy.
Right. This was super helpful. Really appreciate your time today. Thank you so much. And I'm sure a lot of people watching this are going to get a lot of value out of this. Thanks for being here.
Well, thank you for having me.